welcome everybody.
The
So,
next.
so we've spoken about toxicity as a big issue and the lack of detox. So what Prof is going to do for us now, he's going to talk about the biological effects of EHS in terms of what happens in a person's body that's been proven by research. But what I would just like to mention, why we put the toxicity in the middle. What the guys have found, doctors that treat people with EHS, is that there's always a level of toxicity involved, and there's often, and I'll talk about it a little bit later, because I'll talk about the precursors. The body battles to detox. It's either it's got a genetic defect, or you're just not doing enough to detox, or it's so toxified that it's just totally clogged up. So this is a fundamental. If you treat somebody from a medical standpoint with EHS, then detox become very fundamental to the process. But I'm going to let Prof run us through the biological effects, and then I'll talk through the precursors.
Well, thank you very much, Davida. And it's important to understand here that the compilation we have done, they are based from data of electrohypersensitivity, but also for normal healthy volunteers, and also from other types of animals, sometimes even bacteria, plants, etc. So there are different indicators. And the first is, of course, DNA damage, which also from a public health point of view is quite scary because it could lead into, for instance, the progression of cancer development. And that has been proven already in the 1990s, and further on, more and more papers have come out. Then, of course, and that's a hypothesis, the calcium channeling. There are voltage-gated calcium ionic channels in the cell membranes, and they are altered by different forms of artificial man-made electromagnetic signals. So that could be a further stressor to cells. And again, for an ordinary human being, it's not obvious that this is going on. We don't sense or feel it immediately. It takes time. And as Davida said in the introduction, you kind of fill up your glass more and more, and then suddenly you get electrohypersensitivity, or I should say multiple chemical sensitivity and chronic fatigue syndrome, etc. There are a lot of varieties here. Then, of course, nutritional deficiencies. And again, as a medical doctor, these are things you could look for, especially if the patient is not sure at all what's causing the health problems. Some know, kind of, they have an indicator from having played around in their home or workplace. They realize that something is fishy, for instance, with the computer screen, but many, they don't have a clue. They love their work, they love their computer, they love their smartphone, and they don't connect the health problems at all with these gadgets. So then you can look for nutritional deficiencies. What we found very early, and now we are in the 1980s early, was that we had a mast cell activation syndrome with a dramatic increase of mast cells, not only in the skin of electrohypersensitive people, but also when we did provocation studies using normal healthy volunteers, students that we put in front of computer screens and ordinary household television sets. And after a short while, an hour or two, they got a dramatic increase in the number of mast cells in the skin. And this is exactly the pattern you would get if you, for instance, expose a person to X-rays or to other types of ionizing radiation like alpha, beta, and gamma radiation. The only difference would be that gamma radiation, you would have more or less an immediate reaction. With X-rays, maybe 10-15 minutes, depending on the strength. And with non-ionizing radiation from a computer screen, maybe 1 or 2 hours. Foolishly enough, I had to admit, we didn't have shorter exposure times because we believed at that early experiment that we wouldn't find anything. But then it turned out that we had this dramatic mast cell activation reaction. And then you have protein factors like 8.5. There are others as well. There is quite a wealth of literature. Many of the heat shock proteins, like number 70, reacts in these exposure situations. Going back to our studies, we saw also a very big increase in the number of so-called dendritic cells. The most famous of them in the skin is, of course, the Langerhans cells, but there are others deeper down in the dermis. And there is a huge increase in number. And I remember when I showed some photograph for a clinical colleague, and he didn't know at all what I was doing. He said immediately, "Oh, you are studying people with a dramatic activation of the immune system. Probably they have some flu of some type." And then I asked him, "How can you say that?" And he pointed to the dramatic increase of these dendritic cells. So he was right, of course. At the same time, and this is very typical in medicine and biology, as you know, when the number of cells start to increase, that's a sign. It's like workers in a car factory. If you need to employ more and more and more and more workers, maybe you are selling a lot more cars, or they are becoming fatigued. They are becoming tired. They don't work very well. And to keep up the volume, you need to have more and more and more workers. And that points to that it could be an immune suppression. And it's also followed in parallel by cortisol suppression. So there could be a number of different factors. Sort of initially not making sense, but if you put them together, they do make sense. And as I said before, there is a wealth of scientific papers pointing to that, for instance, cell phone radiation will deteriorate your immune system over time, making you more and more sensitive to different provocations. And here in Sweden, for instance, if you look upon children and teenagers up to the age of 14, more than half of them have some type of oversensitivity, asthma, or allergic reaction. When I was a kid, it was less than 0.5% of the population, but now it's more than 50% of the population, pointing again to that something is not well when it comes to the
Mm.
health status.
Mm. Prof, I want to add a few things. So on the DNA damage, maybe you want to just briefly talk about the publication that the World Health Organization did and their classification of EMF as a possible carcinogen, and the article that came out, I think it was May this year,
Yeah,
linking
yeah.
cancer to
Yeah,
animal
that's
cells.
a very important point you point to. It's kind of a sidetrack compared to electrohypersensitivity, but at the same time, not. And I often ask ordinary people here in Sweden or wherever I go, I ask them if they are aware of that already in the year 2000, the World Health Organization in Geneva, in Switzerland, cancer classified first power frequent magnetic fields, ordinary household electricity, because of its association with childhood leukemia. 10 years later on, all radio frequent fields, including all types of Wi Fi routers, wireless laptops, cell phones, DECT phones, and so on, were classified in the same way as a possible carcinogen and in association with certain brain tumors. And last but not least, very recently, just a few weeks ago, the World Health Organization concluded that also such risks are found among animals. And including DNA damage, which has been picked up earlier in some huge, big national programs in the United States and in Italy. So there are so many pieces of the jigsaw puzzle, but for the layperson, of course, they are not aware of this. They love their smartphone, they use it, and they don't see that maybe they risk something.
Yeah.
I often run into situations where people get actually upset with me because I talk about this, but after a few minutes they realize that I'm not lying, I'm not making this up, because with their smartphone in their hand, they can Google this and realize that yes, the World Health Organization has really done this. And all these
Mm.
classifications, they stand today. They have not been changed in any way.
Absolutely. Just a few more builds on what you've said. So, on the calcium channeling, how that typically could manifest in symptoms is um, body aches and pains, muscle weakness, bone um, degeneration, things like
Yeah,
osteoporosis.
yeah,
So, keep an eye on that. And then the histamine one, the multiple chemical or the MCAS, the mast cell activation, very, very typical to both EHS and multiple chemical sensitivities is allergy-related symptoms, and it
yeah,
could be
yeah,
any allergen. So the
yeah.
MCAS typically manifests itself in allergies, and then the protein factor 8.5, that is one that's close to my heart. That actually talks to your nerves, and some patients would actually experience numbness in their hands or feet. Fingers will go completely numb. And that is where the nerves are being affected. So yeah, I just wanted to highlight one or two examples
Yeah,
there.
and finally, David, I would also remind, even though it's superfluous in a way, that any medical doctor, of course, finding these kind of changes, that's very important, and they should try to mark it down and compile histories
Yes,
from different patients, but also be very open-minded. Maybe the person's electro-hypersensitivity that the person claims, maybe it's something completely different, so that you don't miss out, because that could be
yes,
serious, of course. So be
absolutely.
open-minded, and again, as I said, a good indicator is if you can try to remove the source of irritation, and see will that have an impact or not. That could lead you in different directions.